Thank you very much for the opportunity to present a very important topic, Safe Blood in sub-Saharan Africa, our challenges and opportunities. This is my disclosure, outline of my presentation. Low availability of safe blood for transfusion still remains a major challenge in sub-Saharan Africa. We have challenges maintaining sufficient, high quality, safe supplies of blood and blood components. Now, we know that blood supplies need to be constantly replenished. There's increased clinical demand for blood and blood products generally. Generally, high-income countries are able to meet the demand for blood and blood products, whereas in sub-Saharan Africa, we are still lagging behind. Now, transfusion of safe blood and blood products, we know, saves millions of lives worldwide. Therefore, we do need an optimal population of adequate voluntary blood donors. Not just recruit them, but also be able to retain these blood donors in the blood donor pool. Blood safety remains a major challenge in the sub-region. And there are several reasons why it remains a major concern for us. A few are due to resource constraints, the high prevalence of transfusion transmissible infections, persistent reliance on family replacement donors. Now, these difficulties have led to chronically insufficient safe blood supply in many countries in the sub-region. Now, what are some of our challenges to safe blood supply? There are several challenges. We've highlighted a few. What education are we actually giving to the public concerning blood transfusion? Demystifying some of the myths surrounding blood transfusion. Is this education sustained? What media platforms are we using to get the message out there to the public? So this is an area that is lacking in sub-Saharan Africa and should be addressed. Now, the opportunities that exist for us are numerous, but we have highlighted a few, and that is transforming the family replacement donor system to a voluntary blood donor system. We need culturally appropriate interventions. Now, some have been implemented in some countries and have helped in the blood donor pool and to retain some of their voluntary blood donors. So interventions like the planned annual calendar for blood donation, education, and mobilization, the peer recruitment programs like the Pledge 25 Club, and there are other suggested interventions such as motivational incentives, sending reminders, and mass media adverts, and so on. We need to be able to boost, blood donation among women. How do we do that? Targeted interventions, addressing their fears, having a sustained and planned educational program for them, demystifying some of the myths surrounding women donating blood. And these can be done through a lot of, like social media platforms as well. Reducing rates of donor deferral due to anemia will certainly help a lot, and we will be able to retain a lot of our blood donors. Now, what kind of education are we giving them as well? Nutritional education will certainly help. This can be done through mass media, mobile phones, and so on. Giving iron supplementation after each blood donation. These are some of the interventions that have been tried and tested in some parts of the world. Increasing the blood donation intervals is also a suggested approach to reduce donor deferral due to anemia. We also need to address knowledge and communication gaps. We know that a lot of communication interventions are being explored now. Partnerships between blood banks and radio stations, for instance, has been tried and tested in Ghana, and it has helped a lot, using mobile phone technology and a whole lot more. So these are all some of the opportunities that we have to improve our blood donor pool. Our key messages are that transfusion transmissible infections, especially malaria, are prevalent among blood donors. The family replacement donor system is predominant. There's a substantial proportion of blood donors in sub-Saharan African countries who are still being deferred due to anemia. Women are underrepresented in the blood donor pool. Poor knowledge and communication regarding blood donation. Financial constraints also hamper the supply and maintenance of our national blood services. These are a few of our recommendations to develop and adhere to national policies on blood donor selection, to include malaria screening in our national transfusion service programs, especially during the malaria seasons, and also to complement the national efforts in hepatitis B vaccination. We need to improve donor care. It's most of the time neglected, through regular assessment of iron stores, follow-up telephone calls. We need to generally encourage our donors so that they would come back and donate and remain in the donor pool. Communication approaches could help to address the scarce or inadequate knowledge about blood donation. So in conclusion, WHO, through their Global Blood Safety Initiative, encourages the principle of voluntary unpaid donations. The current systems of blood donation, with very few voluntary blood donors in sub-Saharan Africa, are unable to sustain our transfusion requirements. We now have greater health coverage, better access to health care. There's increase generally in demand for blood products. We need investments in screening. What screening methods are we using? Are we engaged in any quality assurance, external quality assurance programs? How well are we performing in these programs? We need specialist hematology services in our national blood banks and in sub-Saharan Africa. They can help with our limited research capacity and also care for our donors and the general population. There's therefore the urgent need to design, implement, and evaluate innovative communication approaches to help communication and strengthen innovative communication approaches to help strengthen sub-Saharan Africa blood transfusion services. And this can be done through social media. There are so many social media platforms now. The mass media, transfusion research is limited in the sub-region. It's time to do a lot of research concerning safety and availability of blood in the sub-region. Misconceptions such as religious and cultural specific must be adequately and tactfully addressed. Lastly, the public-private partnerships to support our national blood services and to improve the quality of blood services and the blood safety value chain is needed. Thank you very much. I would like to acknowledge all my co-authors, Dr. Lucy Asamoah-Kouakou of the National Blood Service, Ghana, Dr. Bernard Appiah, Syracuse University, Professor Alfred Yolson, and Professor Olayemi, both of the University of Ghana Medical School. Thank you very much.